So now we will be doing lumbar flexion, ROM of lumbar flexion. So first we will be palpating the PCs of the patient. And at the middle of that is the S2. So that will be our location. And the other side is on the parallel to the C7. So now, patient, I want you to bend forward. So, in getting the lumbar flexion, I put the 15 centimeters minus the value that I get when the patient bend over. So the normal values is 6 to 7 centimeters. So now we will be getting the lumbar extension range of motion of the patient. So palpate again the PCs. And at the middle of the two pieces is on the S or spinal process. Patient, I want you to lean back. So what I did is I put from the S2 up to the parallel to the C7 and 15 centimeters. Then I let the patient lean back and minus the value that I get when he did lean back to the 15 centimeters. So the normal values is 6 to 7 centimeters. And
now we're going to do the ROM of hip flexion. For the landmarks, the fulcrum is on the greater trochanter femur. The proximal arm is on the lateral midline of the pelvis, and the distal arm is on the lateral midline of the femur. So, ang hip flexion po is angat ilong po yung paa nyo. Then, gawin nyo na po hanggang sa kaya nito. Now, passive naman, ako lang po yung magagawa. Then, apply over pressure. And the normative value is 0 to 120 degrees and the Hnp is soft. And now we're going to do the ROM of hip extension. The landmark is greater trochanter femur. Proximal arm is on the lateral midline of pelvis, and the distal arm is on the lateral midline of femur. Then, iangat nyo lang po itong paa nyo. Yan. Ulit po. 1, 2, 3, go. Okay na po. Then, ako lang po yung magagalaw. Normative value is 0 to 20 degrees and the Hnp is firm. Now we're going to do the ROM of hip abduction. The landmarks are the fulcrum is on the ACs and the proximal arm is on the imaginary line to another ACs and the moving arm is on the anterior midline of femur. Ayan. Motion po natin, spinning po natin. Ayan. Iba yun mo. Then passive, ako nung ito up. Then apply over pressure. The normative value is 0 to 45 degrees and the Hnp is firm.
Good day. We are going to perform the MMT of trunk flexion. So I would instruct the patient to keep your chin above the ceiling. And then I want you to lift your head, back, and shoulders. So for grade 5, ma'am, I want you to put both of your hands on your head. And then I want you to lift Lift please, as much as you can. Okay, grade 5 si patient pag na-lift niya hanggang inferior angle of the scapula. Okay po, baba. Now, pag merong tightness sa hip flexor si patient, we are going to put stabilization in here. Okay po, lift po. Okay, very good. Down. That's grade 5. And then for grade 4, we are going to instruct the patient to, pag di na kaya ni patient yung kanina, so ganito naman po. And okay, patient, I want you to lift as much as you can. Okay, very good. Down. That's grade 4. And then for grade 3, pag hindi pa rin po kaya yun, this is against gravity naman po kasi the arms act as resistance. So I want you to, ayan. Ayan, okay. Very good, okay. Down. For grade 2, patient can only lift her head. Ayan, grade 2. Hindi niya kaya i-lift yung shoulders niya and back. And for grade 1 is, okay ma'am, I want you to contract. Or like cough. Can you cough? Okay. So merong palpable contraction sa abdominal area pag grade 1.
Sabihin mo kung saan yung placement ng kamay.
So for the MMT of trunk extension, the patient is positioned in prone with head and upper trunk dangling off the table, and it is about the nipple line. So patient, I want you to put both of your hands behind your head. Yan. And then I want you to try to lift your body, yes, your head and your back. Okay, if the patient completes the range of motion, it is graded grade 5. But if we saw the patient struggle and nahirapan siya, it is graded grade 4. Next, for grade 3, patient, I want you to put both of your hands beside here. Yes, okay. And then I want you to lift again. Lift. Okay. That is graded grade 3. For grade 2, patient, I want you to move downwards the table. Okay, grade 2. Patient, please try to lift your body. Okay. If the patient completes the partial range of motion, it is graded grade 2. But then okay, down. But then for grade 1, we are going to palpate in the trunk extensors. Okay, please contract your back. Okay, there is a palpable contraction, so grade 1. Pero pag wala naman pong contraction, it is graded grade 0. Next is the MMT of the hip flexors. So to test this, we are going to have the patient in a short sitting position and with knees dangling off the hip. Okay, now patient, I want you to bend your leg, lift it off of the table. If the patient completes this, the patient is graded grade 3. Now we are going to apply resistance. Okay, patient, I want you to lift your leg and don't let me bring it down. Okay, if the thigh clears the table, then the patient is graded grade 5. But if there is a give, then it is graded grade 4. Next is for grade 2. If the patient is unable to do all of those, then we're going to have the patient in a sideline position. So I will put stabilization on the pelvis, and I will put my right hand on the medial aspect of the knee, and I will lift it for the patient. Now patient, I want you to bend your hip. Okay. Then if this is completed, this is graded grade 2. And then if the patient is unable to do this, so if the patient is unable to do all of those, we're going to test for grade 1, in which we're going to lift the knee, and put the hip in a flexed position, and then we are going to palpate the hip flexor muscles. Okay, patient, please contract your muscles. If there is a contraction, then it is graded grade 1. But if there is no palpable contraction, then it is graded grade 0. For the MMD of the hip extensors, the patient is positioned in prone. We're going to ask the patient to Patient, I want you to lift your right leg off of the table as high as you can without bending your knee. If the patient completes this, then the patient is graded grade 3. Bring it down. Now, for grade 5, you're going to apply resistance on the ankle. Okay, patient, I want you to lift your leg and don't let me bring it down. Okay. If the leg clears the table, then the patient is graded grade 5. But for grade 4, we are going to move the resistance to the behind the knee. Okay, patient, I want you to lift your leg above the table. Okay, this is grade 4. And then for grade 2, patient, please be in a side lying position. Okay. We're going to put stabilization on the pelvis and then lift, cradle it, and then patient, I want you to extend your leg, move it behind. Okay. If the patient completes this, then the patient is graded grade 2. Okay, please be in a prone position. Again, patient. For grade 1, patient, please contract your muscle. If there is a palpable contraction, then the patient is graded grade 1. But if there is no contraction on the hip extensors, then the patient is graded grade 0. So for the Hnp of the hip abductors, the patient is positioned in a side-lying position. We're going to ask the patient to lift their leg above the table. So please lift your leg up. Okay. So if the patient completes the range of motion without resistance, then it is graded grade 3. Okay. Lift your leg again. So for grade 5 resistance, we're going to put the resistance on the ankle. Okay, don't let me put your leg down. If the patient can accomplish this, then the patient is graded grade 5. Next is for grade 4, we're going to apply resistance on the knee. Rotation, please lift your leg again. So if the patient can accomplish the resistance on the knee, then it is graded grade 4. Next is for grade 2. Next is for grade 2, I will ask the patient to be in a supine position. Okay, I will apply resistance on the ankle area. Please move your leg away from your body. Okay. If the patient can accomplish this in a graphically eliminated position, then the patient is graded grade 2. Then for grade 1 and grade 0, we're going to palpate the hip abductors. Okay, please contract your muscle. If there is a palpable contraction, then it is graded grade 1. But if there is no palpable contraction, then it is graded grade 0. For the Hnp of knee flexors, we're going to have the patient in a prone lying position. So, patient, I want you to bend your knee. If the patient completes this, then the patient is grade 3. We're going to put stabilization on the thigh area, and I'm going to put resistance on the ankle area. So, patient, I want you to bend your knee again. Then I'm going to put resistance. Patient, don't let me push it down. Okay. If the patient is able to tolerate maximal resistance, then the patient is graded grade 5. But if the patient is only able to tolerate strong to moderate resistance, okay, please, don't let me push it down. The patient is graded grade 4. Next, patient, please be in a side-lying position. Okay, patient, please bend your knee. If the patient is able to complete partial range of motion in a side-lying position, then the patient is graded grade 2. Okay, patient, please be in a prone position. Okay, I want you to bend your knee. If there is a palpable contraction on the knee flexors area, then the patient is graded grade 1. But if there is no palpable contraction, then the patient is graded grade 0. for the MMT of the knee extensors, we're going to have the patient in a short sitting position. So, patient, I want you to straighten your knee. If the patient is able to do this, then the patient is graded grade 3. Now, I'm going to apply resistance on the ankle area. Patient, please straighten your knee again. Okay, don't let me bend your knee. If the patient is able to tolerate maximal resistance, then the patient is graded grade 5. But if the patient is only able to tolerate strong to moderate resistance, again, the patient is graded grade 4. Next patient, I want you to be on the side lying position. Okay, I will cradle, straighten this. Okay. Patient, I want you to straighten your knee. Okay. If the patient is able to complete partial range of motion in the side lying position, then the patient is graded grade 2. Okay, patient, please be in a supine position. Okay. So for grade 1 and grade 0, patient, push your knee on the bed. Yeah, push your kneecap down. If there is a palpable contraction around the kneecap, then the patient is graded grade 1. But if there is no palpable contraction, then the patient is graded grade 0.
For the anthropometric measurement, we're gonna measure the apparent leg. The landmark is on the umbilicus and the median malleolus. And compare it to the other side. For the true leg length, the landmark is on the ACs to the median malleolus. And compare it also to the other side. The normal difference between legs are 1.5 cm.
Good day. So now we'll be using SLR5 to check for any nerve root affectation or disc prolapse. So if the patient is right affected, so we will be using the left hip. So we will be flexing the hip with the knee extended and dorsiflexor of the ankle. So the test is positive if the other side or the affected side will be increasing the numbness. Good day. So now we will be using piriformis test. So position the patient in a side-lying position, at the edge of the table. And we will be positioning we'll be hip flexion 60 degree with the knee flex and the lower leg extended. And we will be putting some stabilization on the pelvis. So the test is positive when the patient feels pain at the buttocks and or radiating pain at the backside of his leg. Good day. So now we will be using special test called tripod test. So position the patient in a short sitting position. Are you comfortable with that position?
Yes.
So we will be extending the knee of the patient. And to compare to the other side. The patient is positive in hamstring contracture if the patient compensate or extend his back just like what did the patient do. Good day. So now we will be doing Mackenzie back program. So the first step is lying on stomach. So at this position, the patient is lay on stomach with arms under her shoulder or down at your side. So the patient head facing down or turned to one side. So patient, take deep breath and relax, and then hold for 5 minutes. So for step 2 is lying on pillow. So let the patient lay on stomach with arms at your side with a pillow placed under or directly under her chest. So the head of the patient is facing down or turned to one side. So take a deep breath and relax, then hold for 5 minutes. Patient, please do the position po. So the next step is prone on elbows. So lay on stomach and place your elbows under your shoulder so you are resting on your forearms. So take a deep breath and relax, then hold 30 seconds, repeat 10 times. Patient, please do the position. So next step is step 4, which is prone press-ups. So on this step, lay on stomach, place your hands under your shoulder, slowly straighten your elbows, keeping lower body relaxed while raising the back upwards as fast as pain will allow. So this will be holds for 10 seconds and then repeat 10 times. Patient, please do the position po. Next is the finding pelvic neutral. So patient, tight your abs muscle po. Next is draw the belly button in, then flatten your back. So the technique here is like you're like a snake, like say the letter S, like shh, then try to pull out the towel with your hand. Then please patient do. So a proper core contraction should prevent the towel from moving. So this is the starting position for all core exercises. As we can see, while the patient doing the S sound or like a snake sound, the towel is not moving. Please patient, try it again. Next is quadruped. So first is we should find the pelvic neutral. So patient, please, yung kamay nyo po is ilagay nyo po sa may kabila. And pati po yung isang kamay. Ayan. So after finding the pelvic neutral, the patient will extend the one arm and extend the opposite leg. So like if the patient raise or extend his right arm, she will be raising the left leg. So this will be hold for 10 seconds and then change the arm. So if at first the patient extend the left arm and the right leg, the next is the patient will extend her right arm and then the left leg. So this will be one max set on once a day. So patient, please pakigawa po. And this will be hold for 10 seconds. Thank you. Next is the prone plank. So first we should always find the pelvic neutral, and then the patient will balance on elbow and then squeeze the glutes and hold the position, and then we should check for the patient if she's straighten her back or doing back extension. So the goal will be good, will be labeled good if the patient can hold for 2 minutes, and then the label is great if the patient hold for 3 to 5 minutes, and then this exercise will be for entire core muscles. So patient, itungkod nyo po yung braso nyo po, and then itaas nyo po yung katawan nyo. Okay? So as we can see, the patient is extensioning her back. So ibaba nyo po yung patan nyo po. And this will be the right position. Next is what we called the Superman. So the patient is lie on stomach with arm extended overhead, and then extend the arms and then legs, and the arms should be parallel to ears, and then hold the position for 10 seconds and avoid excessive back extension. So this would be for strengthening the gluteal muscles, hamstrings, and the back muscles. So patient, extend your arms and legs po. So the next is the double leg bridge. So the patient is lie on back with both knees bent 90 degrees, or the knees is flexed 90 degrees, and then slow raise hips up towards the ceiling and then hold for 5 seconds. So this is good to increase the gluteal strength. So patient, gusto ko po yung tiyan nyo is iangat nyo po papunta sa kisame. At this position, the patient should hold for 5 seconds.